This is the Plant Powered Challenge 2022, brought to you by Spectrum Health's Lifestyle Medicine team.
Hello, and welcome to the 2022 Plant Powered Challenge. I'm Elizabeth Suvetti, Manager of Culinary Medicine at Spectrum Health. The Lifestyle Medicine team at Spectrum Health is thrilled to be launching the 5th year of the Plant Powered Challenge, and that you have decided to join us. Past survey participants have reported having more energy, weight loss, better bowel health, improved mood, and better quality sleep. In fact, nearly 80% reported making at least one health behavior change as a result of the Plant Powered Challenge. We're so happy to hear these results, and that's why we continue to offer this challenge every year. And perhaps most importantly, we're all in this together. Feeling supported in a like-minded community is a big part of success in health behavior change. So know that you're not alone. And in fact, thousands of registered participants are joining this challenge with you. You're in good company, and we're so glad you're here. Throughout the 30-day challenge, we will be encouraging you to eat more whole plant-based foods, and we hope to empower you to make lasting change. All of our Plant Powered Challenge programming will be offered for free and will be broadcasted via social media. You will hear from a wide array of experts in the field of food as medicine, including physicians, health coaches, dietitians, and chefs. You also will hear from community members and patients. Please do make sure that you have fully registered for the program to ensure that you will receive all of the weekly emails and recipes that we'll be sending out. This year we have a variety of program offerings, guest speakers, and cooking demonstrations. I'm certain that there will be something for everyone. Our program is designed to give you the knowledge you need to hopefully make lasting change to improve your overall health. I'd like to let you know about all the programming that we will be offering you that you won't want to miss. At the beginning of each week, you will receive an email with some key areas of focus for that particular week, along with suggestions on how to incorporate whole plant foods in your weekly meal plan. We will also provide some recipes that we would love for you to try and see if you like them. Weekly, we have a webinar on Mondays, except for the webinar on Tuesday, January 18th. On Wednesdays, we have panel discussions, and on Fridays, we will end the week with some exciting and fun plant-powered cooking demonstrations. For example, these are some of all the delicious things when we talk about plant-based eating. This is what it might look like. We have some beautiful roasted carrots with a lemon basil drizzle over some farro, a hearty salad with some roasted potatoes that are spiced with some quinoa and a wonderful dressing. Here we have a smashed avocado white bean sandwich with some arugula and red onion and tomato. A wonderful kind of purple smoothie that we have with blueberries and spinach. One of my favorites also, which is our rice and bean burrito, which is a house favorite for us. So as you can see, we love food and we want to show you how to make it delicious and wonderful. Let's talk webinars. On Monday, January 10th, we will be discussing the power of plants in preventing, managing, and reversing heart disease with preventative cardiologist Dr. Tom Boyden. He will share with you how you can prevent a heart attack or stroke or even reverse coronary artery disease through simple food choices. Learn how Dr. Boyden helps patients get results that are not possible with medications or bypass surgery by addressing the root cause of disease. On Tuesday, January 18th, Dr. Carl Nadowski will be joining us to talk about nutrition and physical activity for the prevention of non-alcoholic fatty liver disease. Dr. Nadowski is a clinical endocrinologist for Spectrum Health. He was a collegiate athlete and served as the strength and nutrition coach for the Michigan State University wrestling team. We are excited to hear about his experiences with physical activity and nutrition within his field of medicine. On Monday, January 24th, 3 of our lifestyle medicine providers will be talking with you about raising plant-powered children. They will be discussing the obstacles of raising a plant-based family while offering strategies for facing these obstacles. Our final webinar will be on Monday, January 31st, in which Dr. David Katz, a world-renowned specialist in preventative medicine and lifestyle medicine, will be joining us to expand upon the science-backed evidence for eating more plants and less meat to address the global pandemic and the health of our planet. You won't want to miss this extra special Plant Powered Challenge grand finale. Now for panel discussions. This week, after kicking off the challenge today, we have a panel discussion on how to make health behavior change. During this panel discussion, 4 of our lifestyle medicine health coaches will discuss key strategies for making sustaining health behavior change. The following week, on Wednesday, January 12th, lifestyle medicine physician Dr. Carolyn Vollmer will be joined by lifestyle medicine patients in discussing the power of plant-based eating. During this panel, you will hear and hopefully be inspired by people who have transformed their health using lifestyle as medicine. For our last panel discussion, on Wednesday, January 26th, you'll connect with community health advocates to learn about resources to support your plant-based journey long after this challenge is over. In our book club discussion on Wednesday, January 19th, Dr. Artz will be discussing the book titled Mastering Diabetes, the Revolutionary Method to Reverse Insulin Resistance Permanently in Type 1, Type 1.5, Type 2, Pre-Diabetics, and Gestational Diabetes. If you are interested in participating, check out or get a copy of the book and read it before the book discussion. That's your homework. As a chef by background, I'm really excited to tell you about our 4 plant-powered cooking demonstrations. Later this week, Dr. Talandra Bragg will be joining us in the teaching kitchen for a plant-powered breakfast. Next week, we'll be joined by Dr. Rima Shah to cook up some tasty plant-powered lunch recipes. The following week, we'll be joined by Javin Hay and Dion Ford from the Urban League of West Michigan. Together, we'll be cooking up some mouth-watering plant-powered dinner recipes. Finally, we need to celebrate our accomplishments throughout the challenge, so please join us on Friday, January 28th for our plant-powered party, where we will be joined by guest chef Raul Ortiz from the Community Food Club. Chef Raul and I will be showing you how to make some awesome plant-based appetizers as well as some mocktails so that we can toast to your success. I'd like to share some tips with you on how to get the most out of this challenge. Be honest with where you are today as it relates to incorporating whole plant foods in your diet. There's no judgment here. We are not suggesting that you need to switch to a 100% whole plant food diet if that is not your goal. Instead, evaluate where you're at today with how many whole plant foods you eat in a day and in a week. Those would be things like whole grains, fruits, vegetables, beans, nuts, seeds, legumes. Then decide how much more you are willing to add within your weekly menu of what you're eating at home. And make sure that you do it in a sustainable way that you can manage. While this is a 30-day challenge, the goal is that it becomes part of your lifestyle and that you can adapt these changes for the long haul. At the beginning of each week, you will receive an email with specific goals to focus on for that week. Take a few minutes to read through that email and think through how you can apply the suggested areas of focus to your weekly routine. We will remind you about the various sessions coming up each week and provide some delicious recipes that I encourage you to make. While you may not be able to watch each session as it is aired at the exact time, I do encourage you to make it a point to watch each of them at some point that week. There will be a wide variety of content and presenters. Hopefully you will learn something from each one of them. With change, we find it is helpful to have ongoing education so that you can continue to be reminded about the why and the how of whatever your changes are that you're trying to strive towards. Make sure to engage with us on the Spectrum Health Lifestyle Medicine Facebook group during this challenge. This is a Facebook group you will be able to view previous programming as well as hear from our team and community members. Again, I want to thank you for taking the first big step in improving your health by joining this challenge. If there are other people that you know of who have not signed up who you know might be interested, please share the information with them. It's not too late to register. Now, I'd like to introduce you to a colleague of mine whose knowledge of food as medicine runs wide and deep, Dr. Christy Artz, board certified in lifestyle medicine. Dr. Artz is the medical director for Spectrum Health Lifestyle Medicine. She is also board certified in emergency medicine, a place where Dr. Artz continues to take on extra shifts to help care for patients from our community with COVID and other serious health conditions. With that, I'd like to turn it over to Dr. Artz so she can impart all of her wisdom on all of us. Welcome, Dr. Artz, to the 2022 Plant Powered Challenge. We're so glad you could join us today.
Thank you, Elizabeth, for kicking us off for the 2022 Plant Powered Challenge. I'm Dr. Christy Artz, Medical Director for Spectrum Health Lifestyle Medicine. I'm sure many of you are entering this year's challenge with your own personal reason for why you want to include more whole plant foods in your diet. If you need additional reasons for why you might want to do so, I'm going to share with you my top 10 reasons why eating more whole plant foods can be great for you and your overall health. Number 1, prevent common chronic diseases. Aside from age, poor diet quality is currently the single greatest risk factor for many of our most common chronic diseases. The common link between many of these diseases stem from the standard American diet, or SAD, which is high in salt, sugar, and fat, and causes chronic inflammation, oxidative stress, and changes in our gut microbiome. An eating pattern that emphasizes whole plant foods works to decrease inflammation, reduce oxidative stress, and improves the overall health of our gut. In fact, in an article published in the Journal of the American Medical Association in 2016 reports that replacing even 3% of dietary protein from animal sources with proteins from plant sources like whole grains, vegetables, beans, legumes can reduce the risk of death regardless of any other lifestyle behaviors. So this would be the equivalent of eating just one serving of beans in place of animal protein, which means that even making small changes can have a significant impact. Reason number 2, reset your palate to the taste of real food. Whole plant foods are high in micronutrients and perfectly packaged with fiber to provide what our body needs to stay healthy. Contrast this with store-bought packaged and processed foods, which are designed to be hyper-palatable. What that means is that our body has a really hard time controlling our intake, and these types of foods keep us coming back for more. In our lifestyle medicine practice, we often start our patients on a palate reset, or what we call a jump start, to reacquaint their taste buds with the taste of whole plant foods. Many people are so surprised to find out that they can successfully reset their palate within a matter of a couple of weeks and begin to very much enjoy more whole plant foods. Reason number 3, achieve and maintain a healthy weight. The calorie density approach to eating is one of the simplest and most powerful approaches to improving the overall quality of your diet and achieving a healthy weight. Calorie density is defined as the number of calories in a given weight of food, usually expressed as calories per pound. Whole plant foods are naturally high in nutrients, fiber, and water, and low in calories, meaning that you can enjoy these foods until you feel full, satisfied, and this becomes a very intuitive way of eating, making this a very sustainable way to have a healthier diet. Reason number 4, improve your health span. Health span is defined by lifestyle medicine expert Dr. David Katz as adding years to life and life to years, or disease-free longevity. And this is best illustrated by our blue zones throughout the world. Blue zones are areas around the world where the highest percentage of centenarians who are active and vital into their 11th decade of life. However, what we see in the United States, and this was published in 2020 in the American Heart Association report, is that there's a 13-year gap between living and living well. So improving diet quality by eating more whole plant foods equates to increasing your health span and healthy aging. In fact, Nobel Prize-winning scientist and author Dr. Elizabeth Blackburn has studied the protective cap on our chromosomes called telomeres and their impact on aging. Think of these as the little cap on the end of your shoelace that helps it from becoming unraveled. Dr. Blackburn provides this dietary recommendation for increasing the length of your cell's telomeres. Eat more whole plant foods, including beans and legumes, whole grains, nuts and seeds, and other brightly colored fruits and vegetables. Reason number 5, strengthen your immune system. As we all know, we've been in the midst of a pandemic over the last couple of years. and we can do so much to improve our immune system by eating more whole plant foods. In a report published in the journal Gut in 2021, a diet characterized by healthy plant foods was associated with lower risk and severity of illness related to COVID-19. Plants are rich in disease-fighting fiber and phytonutrients, which support a healthy gut, and our gut makes up 70% of our immune system. Fiber is only found in whole plant foods, and particularly in foods like beans and whole grains. Reason number 6, support the health of the planet. A plant-forward diet is what the Eat Lancet Commission calls a win-win diet, which means it's healthy both for the person and the planet. Their report states that, quote, food is the single strongest lever to optimize human health and environmental sustainability. Among 80 solutions for reversing global warming, plant-rich diets ranked number 4, according to Project Drawdown. In addition, Menus of Change, a collaborative between the Harvard School of Public Health and the Culinary Institute of America, recommends this approach to sustainable eating. Think produce first, make whole intact grains the new norm, move legumes and nuts to the center of your plate, and of course drink healthy beverages like water, coffee, and tea. Data even suggests that millennials are leading the charge in the shift toward a diet centered on whole plant foods and a shift away from meat for purposes of improving the health of the planet. So I say let's join them. Reason number 7. Take fewer medications. Plant-based dietary patterns such as the Mediterranean diet and whole food plant-exclusive diets have been widely studied in both preventing and reversing cardiovascular disease and risk factors for things such as high cholesterol, obesity, hypertension, and type 2 diabetes. The Journal of the American Heart Association in 2021 stated that consumption of a plant-centered, high-quality diet starting in young adulthood is associated with a lower risk of cardiovascular disease by middle age. In addition, Drs. Caldwell Esselstyn and Dean Ornish have studied the impact of whole food plant-based dietary pattern on cardiovascular disease reversal. We've seen many patients with both cardiovascular disease and risk factors for cardiovascular disease and have applied a plant-rich diet and seen a corresponding decrease in need for medications used to treat high blood pressure, diabetes, and high cholesterol. So my advice to you is seek out a physician who is able to help guide you in implementing a whole food plant-based diet as part of your treatment plan. Reason number 8. We often hear people state that they think a diet centered on whole plant foods can be incredibly expensive. However, a couple studies will highlight that in fact it can lower your grocery bill. In 2015, a study published in the Journal of Hunger and Environmental Nutrition found that eating meatless meals can save you nearly $750 a year. A 2017 report from the Institute of Economic Affairs showed that buying fruits and vegetables is cheaper than buying processed junk foods, ready meals, and takeout foods. How about if we compare the price of a fast food cheeseburger, about $1? Based on national averages, you could purchase 1 pound of apples, 1 pound of sweet potatoes, or 1.5 pounds of carrots for the same amount of money. So not only are healthy foods more economical at the grocery store, but in the long run, they can help you save massive amounts on medical bills. Reason number 9, we're almost there. Experience better flavor. Eating more whole plant foods means including room for more herbs and spices, not only to provide delicious flavor, but powerful disease-fighting benefits. Too much added salt can elevate blood pressure and lead to damage in the arteries in the body, increasing the risk for heart disease, kidney disease, and impact our brain health in negative ways. When we include things like herbs and spices into meals, it's one of the easiest ways to take advantage of the power of plants. Whether fresh or dried, they are rich in antioxidants and phytonutrients, and they're capable of fighting inflammation, lowering cholesterol, and may even have protective effects against cancer. Plus, they just taste delicious. So think of your spice rack as your medicine cabinet. And finally, last but not least, leverage the power of changing in community. You're all here today to join our Plant Powered Challenge. And we know that when you're looking to make changes in your diet and lifestyle, support is essential. So we need to learn new skills, we need to eliminate triggers, and we need to gather that social support to make these sustainable lifestyle changes. Through this challenge over the next 30 days, we will be your support system. You've joined our community, and we are so excited to have you. Think how you can learn new skills, gain support, and become healthier now and for a lifetime. Thank you so much for listening.